Assalamu alaikum. My name is Sabahat and I'm here to share some information about the rational and irrational use of the drug. And the drug that I have been assigned with is an influenza vaccine. So let's start with knowing what is influenza vaccine and what does it mean by rational or irrational use. So the influenza vaccine is the most commonly known among people as via flu shots. But why do we need to use this drug? This drug is actually used to protect the individual against infection by a virus known as influenza virus that causes cold or flu. Now let's recall the term rational. So basically it means where we could use it. So we use it for active immunization or to prevent oneself from influenza viruses and its types. That is influenza virus A, influenza virus B, and other. Or we also done it to protect ourselves from influenza prophylaxis. So there are several side effects that is severe as well as moderate. The severe ones include angioedema, erythema multiforme, bronchospasm, optic neuritis, muscle paralysis, seizures, and the moderate one includes migraine, wheezing, dysphagia, photophobia, sinus tachycardia, and many more. Now let's come to the very important point that who could get this vaccine and what dose should we get. From 6 months to 35 months, we can start this vaccine from 6 months. We could not use it before that. So the dose is if the person is not previously vaccinated with the influenza vaccine, two doses of 0.25 ml is given at least 4 weeks apart. And the person who is vaccinated previously, one dose of 0.25 ml is given. Similarly, from 3 years to 8 years, if the person is not vaccinated, two doses of 0.5 ml is given for at least 4 weeks apart, and if the person is previously vaccinated, then only one dose of 0.5 ml is given. If the person is 9 years old and older than that, so we will give only one dose of 0.5 ml of this influenza vaccine. Now, according to CDC, yearly flu shot is recommended for everyone that ages 6 months or older. And how long this vaccine shows its effects is it shows its effects for at least 6 months, and usually it is preferred to give in the month of October because it's the season of winter, so people get the flu more often on this month. Now, dose adjustment. Uh, there is no specific guidelines available for the dose and adjustments for this particular vaccine. Uh, Especially in hepatic and renal impairment, there is no guidelines available, so no dosage adjustments are needed. Drug interaction. There are several interactions of this drug, such as concomitant administration with other vaccines. These vaccines should not be mixed with any other vaccine in the same syringe or vial. If vaccine is given at the same time as another injectable vaccine, a vaccine should always be administered at different injection sites. It should not be given at the same injection sites. Immunosuppressive therapies. If influenza vaccine is administered to immunosuppressed persons or person receiving immunosuppressive therapy, immunologic response may be diminished. It means that person, if he is already having any immunosuppressive therapy, then if we administer the influenza vaccine, it would uh, diminish or reduce the immunologic response that would be very not useful for the person. Okay, what are the irrational use? Irrational use is something that it's like we shouldn't use that vaccine. So there is no irrational use has been reported because it is a preventive measure, not a treatment. It is used to prevent the disease and is not basically given for the treatment as a treatment. It is suggested for everyone to take it so that they could prevent the disease from having it. There is no alternative choices for influenza vaccine available. One must get it, and we should always recommend, and we should always guide the people to get the influenza vaccine every year. So there are further interactions of the influenza vaccine with the drugs, that is brodalumab, izokibep, siponimod. These are the few brands and their prices, such as Influvac injections, which is manufactured by the Abbott. It is the least expensive one, and there is Vexigrip, and the most expensive one is the Tetrax, which is manufactured by the Sanofi Aventis. So these are the company, these are the alternative brands of influenza vaccine. They have been manufactured by different manufacturing industries. Now let's move to the case study related to this vaccine and related to this drug. It states that a 29-year-old female comes to an emergency department having a complaint of dyspnea, myalgia, and rhinorrhea. She began with with the symptoms 1 day ago, and it is getting worse with time. She is having nasal discharge, but she is not having a cough. Her 4-year-old son has experienced rhinorrhea as well as over the past 3 days, but is not as ill as she is. She has no medical history of taking any medication. She was a smoker, but she quit when she got pregnant. So various physical examination was taken. Her vitals were normal. Her radiology, her X-ray showed diffuse bilateral inflates. Micro was normal when it is given when we took the rapid flu swab test. It shows influenza A. It was positive, and all the physical labs were normal. Just wheezings and was shown in her test. So we made a SOP notes about the subject that she is 29-year-old. Her gender is female, and her vitals were normal, and we assessed that it is she is diagnosed with influenza as flu swab test shows positive result. We ruled out the pneumonia because she doesn't have a cough, which is the typical symptom of bacterial pneumonia. Also, she had other reasonable alternative explanation for her symptoms and clinical findings. We suggest as an initial therapy that the patient needs to be admitted to the hospital for respiratory support because she is having difficulty in breathing, as well as we start an antiviral oseltamivir 70 milligram per hour for at least 5 days. If this and we suggested that if it persists, if it doesn't um, get prevented or get treated, so it would take 10 days and the therapy continue for 10 days. We also suggest the person after being treated properly to prevent the exposure of influenza again. We recommend to take a flu shot of influenza vaccine, and we also suggest her to take it every year. Uh, there are some important points related to this vaccine is that um, initiate the therapy within 48 hours of exposure. Do not make it late. Do not start the therapy late because it wouldn't be much effective. And if it is a community outbreak, this therapy should be administered for up to 6 weeks. These are the references from where I have got all the informations. And this would be the end. I hope you liked the presentation, and I hope I have shared the important points related to this drug. Thank you.